Hello, you are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Daniel Okwan. Today's section, I'll quickly run with you the femoral nerve. Now get to know that the femoral nerve, as far as the lumbar plexus is concerned, yes, we emerge from what we call the ventral rami of L2 to L4, but precisely coming from, of course, the posterior division of the ventral primary rami of the spinal nerve segment in the lumbar region. Okay, one thing that we know is that by way of the motor supply, this femoral nerve is the main dominant nerve of the anterior compartment of the thigh. Yes, of course, we also get to know that it gives rise to, the longest cutaneous nerve that you have in the human body, the saphenous nerve. So it is actually a mixed nerve. So at the end of the section, we should be able to tell, yes, of course, the origin, the cause, the various relations of this nerve, and of course, look at, the anterior and posterior divisions of this nerve. And so, without much ado, let's set the ball rolling, looking at the femoral nerve. So there we are. Schematically, I've shown you this, diagram. Okay, when we looked at what we call the lumbar plexus. Okay, we said that this nerve, which is of course the femoral nerve, this nerve over here, which is the thickest nerve, okay, the largest nerve, which emerges from, of course, the lumbar plexus. Okay, is coming all the way from L2, L3, and of course L4. Okay, ventral rami of the spinal cord, nerve segment. But one thing that you have to know is that it's actually emerging from, of course, the secondary, rami, the dorsal rami of what we call the primary ventral ramus of what you call the spinal nerve segment, emerging from the lumbar, region. Okay, that is one thing that we have to know. And so once it emerges, okay, it comes out. So this is one reference point, and that is, of course, the psoas major muscle. Okay, it emerges from, of course, the lateral border of the psoas major muscle, actually between, of course, the psoas major muscle and, of course, iliacus, muscle. Okay, and then once it comes out, yes, it runs underneath. Okay, this ligament that we have over here, the pulpart ligament, the inguinal ligament. Okay, that's the ligament having an attachment from what you call the anterior superior iliac spine, of course, to the pubic tubercle. It runs beneath it, so that's where the nerve emerges out. Okay, now once it runs out just about 2 centimeters below the inguinal ligament, it divides into 2. Now let me show you that one for you to know it. Now just after, so I've told you that yes, this nerve is coming from the ventral rami of L2, L3, and of course L4, the dorsal aspect actually. And then one thing is that they will join to form this thickest nerve, okay, as far as the lumbar plexus is concerned, the femoral nerve. Okay, then we said that it's going to run between, of course, this kind of psoas major muscle and, of course, iliacus. Okay, and it will run underneath the inguinal ligament. Now once it comes out of the inguinal ligament, yes, one thing that we find is that it finds itself in the femoral triangle. So it means that it will be, yes, that's why we know it's the lateralmost structure as far as the content of the femoral triangle is concerned. Okay, it runs laterally over there in the femoral triangle, in that groove between, of course, this psoas major muscle and, of course, the iliacus that we talked about. Just about 2 centimeters below the inguinal ligament, okay, this main trunk, this main nerve divides into 2. And what are these divisions? We have the anterior division and, of course, the posterior division. And this demarcation, okay, is by the courtesy of an important artery, which is the lateral circumflex femoral artery. So you can be asked the question, what artery or what structure serves as the landmark, okay, demarcating the anterior and posterior divisions of the main trunk of the femoral nerve? And your answer is lateral circumflex femoral artery. Okay, various divisions branches will come out of these anterior and posterior divisions. But let's come here now. Before it's divides into anterior and posterior divisions, okay, the main trunk of the femoral nerve gives a branch to supply what we call the iliacus muscle. Yes, we say that this iliacus muscle receives some motor supply from the femoral nerve, but precisely it's coming from the main trunk of what we call the femoral nerve. Okay, one important thing that you have to know. But another one which may also receive, okay, branch from the male trunk will be the pectineus. You know, pectineus is a hybrid muscle. Yes, it's getting that kind of supply from both the obturator nerve as well as from the femoral nerve. Now, if the branch where is coming from the femoral nerve, it may come from, of course, the main trunk of the femoral nerve, or it may also come from what you call the anterior division of what you call the femoral nerve. So that's one, you know, anatomic variation that we can also appreciate over here. Now let's look at the posterior division. If you look at the posterior division, what we find is that it gives that kind of motor supply, okay, to what we call one important muscle. Now the quadriceps group of muscle, the first muscle, you know, one important thing that you know is that coming from what you call the anterior inferior iliac spine, as well as of course from the abdominal margin, okay, the superior aspect over there, we have of course the we have the straight and the reflected hairs respectively of what you call the rectus femoris. So they will be supplied first. So that is why coming from the posterior division of what you call the femoral nerve, okay, we have what you call the rectus femoris getting the supply initially over there. But one thing is that because this area is also related to what we call the hip joint, then one articular branch will also be emerging from, of course, this nerve which is going to supply the rectus femoris. Okay, so an articular branch, okay, to what we call the hip joint, coming from the nerve supplying the rectus femoris muscle. Then beyond that, of course, we also have what we call the vastus naturalis. Okay, muscle is one of the quadriceps group of muscle will also be supplied over there. Then apart from that, we also have what we call the vastus intermedius muscle. Okay, vastus intermedius muscle. Okay, one important thing, vastus intermedius muscle will also be receiving its nerve supply from what we call the posterior division. Now, one thing that we find is that because vastus intermedius muscle is very close to what you call the, articular genu, okay, muscle, then it means that it may also give some, the nerve where you supply vastus intermedius may also supply the articularis, genu muscle. Okay, that is one important thing that we find. Then apart from that, the vastus, medialis, okay, will receive another supply, okay, from this posterior division. And one important thing is because this vastus, medialis, the nerve, okay, is very close to the knee joint, and therefore it also gives articular, supply to what we call the knee joint. Okay, that is what we find over here. Now beyond that, it gives an infrapatellar branch. But one important thing that we find over here is that it gives the posterior division terminates, okay, by giving rise to, of course, the longest cutaneous nerve that we have in the human body, being of course the saphenous nerve. Okay, that is the saphenous nerve. Okay, very important in that regard, saphenous nerve. Okay, so that of course it's going to supply, yes, essentially the skin on the middle aspect of the leg, yes, giving all those supply. It goes beyond that, okay, to the toe, all the way to the ball of the great toe medially. Okay, the longest cutaneous nerve running with, of course, the great saphenous nerve, saphenous vein. Okay, that is the saphenous nerve that we find over here. Okay, so that is an important thing. Now apart from that, if I go to the anterior division of the femoral nerve, the anterior division will be supplying sartorius muscle. Now if already pectineus nerve had been supplied by the main trunk of the femoral nerve, then no problem. But if it had not been supplied, then of course alongside sartorius muscle, then of course pectineus will also be supplied by, of course, this anterior division of what we call the femoral nerve. Then apart from that, we also have what we call the intermediate. Now this was to sartorius a motor supply. Now these guys are cutaneous supply, just like a saphenous nerve from the posterior division. We have what we call the intermediate, or the intermedial cutaneous nerve of the thigh, as well as of course the medial cutaneous nerve of the thigh. Okay, I told you already that of course the lateral cutaneous nerve will become directly from the lumbar plexus. Okay, L3, L4. Sorry, yes, L2, L3 levels. Okay, directly. But the one which will be coming, okay, from what we call the anterior division of what we call the femoral nerve will be, of course, the intermediate cutaneous nerve, okay, of the thigh, alongside, of course, the medial cutaneous nerve of the thigh. So in all, we can see cutaneous nerves coming from what we call the femoral nerve. From the anterior division, we have intermediate as well as medial cutaneous nerves, and then from the posterior division, we have what we call the longest, cutaneous nerve. That is the saphenous, nerve. Okay, so that is one important thing that I want you to know over here. Okay, so in summary, what have we seen? Yes, from L2, L3, and L4. Okay, so look at how easy. You say is the what? The dorsal divisions of the primary ventral rami of L2, L3, L4 spinal nerve segment. okay, from the lumbar region. That's what we see. And the nerve emerges, okay, that nerve, okay, is what we call the femoral nerve. Okay, and we said that the femoral nerve will be running between, of course, the psoas major muscle and the iliacus muscle, and then run beneath what we call the inguinal ligament. Okay, that's the cause. Now, once it runs beneath the inguinal ligament, okay, just about 2 centimeters below the inguinal ligament, then it divides into 2, and with by the kind courtesy of one important artery, where is the lateral circumflex femoral artery, we are able to get what we call the anterior division and, of course, the posterior division. Now, before it divides, then of course iliacus is over there, so it means that it will give them from the main trunk, okay, of the femoral nerve. It gives a branch to give the motor supply to iliacus muscle. Okay, so that is one thing we find. Now, the pectineus, okay, yes, may also receive a nerve, okay, directly coming from what we call the main trunk, okay, that is the nerve to pectineus, or sometimes it may be coming from the anterior division. That kind of variation can exist. Okay, now we're saying that from the anterior division, what do we have? We have the nerve which is going to supply what we call the rectus femoris, which is that same nerve which also give articular supply to, of course, the hip joint. Okay, that is what we find. Then apart from that, we also have the nerve to vastus lateralis, giving that motor supply to it. Not only that, it will also give that kind of nerve supply to what we call the vastus intermedius muscle. And we said that vastus intermedius muscle because the deepest muscle as far as the quadriceps femoris is concerned. Yes, once beneath it we have the articularis genu muscle, okay, so that it supplies the articularis genu muscle as well. Then of course the vastus medialis muscle, okay, the vastus medialis muscle. And for vastus medialis, apart from giving motor supply to vastus medialis muscle, it also gives a branch to supply the joint over there, that's the knee joint. Okay, because very close to the knee joint is going to do that. This one, where is the nerve to rectus femoris, is very close to what we call the hip joint. That's why it's giving the articular supply to, of course, the hip joint. Okay, so that is, what we find. Okay, and one important thing is that once it has done that, then the nerve, okay, will pierce, of course, what you call the fascia lata. Yes, the deep, what you call fascia of the thigh, yes, becoming what you call the saphenous nerve, giving sensory supply to that region below the knee joint, okay, all the way medial aspect of the leg, all the way to the medial portion, okay, medial border of the foot, all the way to the ball of the great toe. That will be the saphenous nerve. Okay, and then of course we're saying that the anterior division, yes, it will give a nerve supply to supply, of course, the sartorius muscle. That will be a motor supply. Then apart from that, it will also give some 2 sensory branches, and they are what we call the medial cutaneous nerve of the thigh, as well as, of course, the intermediate cutaneous nerves of the thigh. Because already we said that for lateral cutaneous nerve of the thigh coming from L2 L3, ventral rami, okay, dorsal divisions, then it means that that one will be coming directly from what we call the lumbar plexus. Okay, medial and intermediate cutaneous nerves of the thigh will be coming from, of course, the femoral nerve. And one important thing I want to show you over here is that just below the point after crossing this kind of inguinal ligament, that's a common location, okay, where this nerve can be blocked, femoral nerve can be blocked. Okay, because that's the point where it's going to divide into anterior and posterior divisions. So it means that if below the inguinal ligament, that's where the nerve is going to be normally blocked, then it means that the nerve where is supplying iliacus, and yes, that one where is supplying pectineus will be spared. Okay, it means that that motor supply beneath that point of inguinal ligament, as well as the cutaneous supply, yes, will all suffer. All right, I'm very grateful for your time this evening. I hope you find this helpful. Have a good night, all of you, and may the good Lord richly bless you. Amen.